So, hi friends, today's our topic is gout. So, what is gout? So, it is one type of arthritis. What is arthritis? Arthritis joint pain plus associated swelling. So, first we will start with the definition of the gout. So, simple definition of the gout is that it is the crystal induced arthritis. It is a crystal induced arthritis without history of trauma. It is crystal induced arthritis without history of trauma. Now we have to know the two important characteristic of the crystal. So first it is the needle shaped crystal. And second it is made up of monosodium urate. In short form we will call it MSU. Okay, so this is the simple brief idea of you can say gout. Now we will proceed with etiopathogenesis, but before that we will know that epidemiology, we can say. So in the epidemiological part, in the epidemiology, it is the disease of middle-aged men. It is a disease of middle-aged men. But you don't have to write this in exam. This is kind of for memory purpose. What will we write in exam? That it is more common in male than female, and most common presenting age is 30 to 50 years. So we can say that it is a disease of middle-aged men. It is a disease of middle-aged men. This is the epidemiology, which is important but not so. So now we will come with etiopathogenesis. So what is etiopathogenesis? So in the etiopathogenesis, there is defect in the uric acid. There is defect in the urate excretion. Kidney can't excrete urate, so the urate level will increase in blood and it will form the crystals in the joint. It will form crystal in the joint, which will result in arthritis. Okay, so this is the most common pathogenesis around in 90% cases, but there are some rare mechanism also. So some drugs are there which can induce gout, like thiazides and pyrazinamide. You have to remember these two. This can also induce gout. Now very high non-veg diet can also induce gout. And third, alcohol can. So these all three are rare, but we have to remember this pathogenesis also. Now what will be the clinical features? So in a single word, I will say the patient come with monoarthritis, or you can say inflammatory monoarthritis. The patient will come with inflammatory monoarthritis. So there will be pain and inflammation most commonly in a single joint of the body. Which is the most common joint in gout? So first, metatarsophalangeal joint, which is a great toe in simple terminology, is the most common, followed by second most common is our ankle joint. Okay, so this is the presentation clinical features. Simple, easy to remember. Inflammatory monoarthritis. Most common joint which is affected is our great toe. Okay, and second most common is ankle joint. So simple. Now we will come with patient has come with this complaint that he has pain and associated swelling in a particular joint, especially grade 2. Now we will do the test. So first test we will ask is screening. So what is the screening test for the gout? So the screening test for gout is serum uric acid level, which is the very sensitive, okay, but not specific. So it is a screening, of course it is not specific. Now what is the specific and the diagnostic test? What is the diagnostic test? Okay, so diagnostic test is, you can say that synovial fluid analysis is a diagnostic test. Synovial fluid analysis, and what will we find in that? We will find strong negative references. So this is the diagnostic, or we can say it is the gold standard investigation for gout, which is the specific. So if this is positive, this test is positive. What is positive result? Strong negative references. Okay, so this is simple. This is all about gout, you can say, but most important part is the treatment. We are doctors, so most important part is the treatment. So how will you treat the patient of the gout? So there can be we can divide treatment in two parts. The patient can come in acute, like patient has having pain recently, and chronic, patient is having severe pain. So in acute we will treat the patient with 3 drugs. First line drug, of course, for any pain, our first line drug is NSAIDs. Example, you know very well, paracetamol, and you can say aspirin, and there are many, indomethacin, naproxen also. If this is our first line drug, this is our, of course patient will come when it is in acute stage. First time patient will come with pain, initial pain. But if the patient is having renal failure, then we will not give NSAIDs, because NSAIDs are contraindicated in renal failure. So what will we give in the renal failure is intra-articular steroid. We will give intra-articular steroid in the renal failure patient, because in the renal failure the NSAIDs are contraindicated. So steroid, it is a very useful painkiller, but the most effective drug is colchicine. But we will not give it as a first line treatment. Why? Because there are 2 important side effects of colchicine. First is myopathy, and second one is severe diarrhea. So due to these 2 side effects, colchicine is our not first line treatment of the acute gout. Now we have learned about the acute gout treatment, but very important part, it's chronic gout treatment. Now you know that patient is having gout for few months, so now these all drugs are we can say symptomatic. These 3 drugs, NSAIDs, intra-articular steroid, colchicine, they will treat the symptoms, but they will not treat the cause. Now in the chronic part, we have to try to treat the cause. So for that we have to know that how does the uric acid excretion in the our normal kidney happens. For that we have to learn about the uric acid production and excretion chart. excretion. So for that, first of all, proteins and purines in the body will be converted into xanthine, and xanthine will be converted via xanthine oxidase enzyme into uric acid. Now this uric acid, commonly this uric acid will be excreted via the kidney. This uric acid will be excreted via kidney. So this is excreted via kidney. This uric acid will be excreted via kidney. But if this step is not occurring, then the uric acid will be more and more in the bodies and in the body, and then we will be having the features of the gout. So this is normal physiological cycle of the uric acid production and excretion. Simple, I have tried to make it simple. Now on the base of this cycle only, we have to make the chart of the drugs in the chronic gout. So we have to stop the, there are two kinds. We can treat the chronic gout via two mechanisms: decrease the formation and increase the excretion of course uric acid. So two mechanisms. So in the first mechanism, we will give inhibitors of xanthine oxidase. Drug which inhibits the xanthine oxidase is allopurinol. This is the inhibitor of the xanthine oxidase. There are one more also, it is febuxostat. So these drugs are the decreasing formation via inhibiting this step, so there will be no production of the gout. This step will be inhibited by allopurinol and febuxostat. Now our second step is increase the uric acid excretion, this step. So our second line drug or second type of drug are increasing the uric acid excretion. So for example of these drugs are probenecid, sulfapyrazone and lesinurad. With these drugs, you have to advise the patient that plenty of fluids should be taken. So these are the two mechanisms, and we are learning the treatment of the chronic gout. So decrease the formation, increase the excretion. How will you decrease the formation? Via the inhibiting the xanthine oxidase enzyme, and example are the allopurinol, which is most important. You have to remember this, must remember allopurinol, and febuxostat is also another example. And for you can say for increasing the excretion of the uric acid, you have to remember example of the probenecids. Okay, but there are also third kind of drug recently approved. So increase the uric acid metabolism. So commonly this is seen in, I will write it with a different color, increase the uric acid metabolism. So commonly this is seen in birds. So this uric acid will be converted into allantoin via the enzyme uricase. Okay, this is our third mechanism, and this is most commonly seen in birds, but we will give this enzyme in human to decrease the uric acid. And the example of the uricase enzyme are the our third kind of drugs. You have to remember example is rasbericase drug and paglo-T case. Most important is raspberry case, so I will highlight it. So this was all about the gout. I have to make it simplify, and this is my initial video, so in some points I have kind of muffled my voice, so appreciate my efforts and spread happiness, because hatred is already in excess. And do like, share and subscribe if you want to appreciate my efforts. Thank you friends.